All right. Well, it's 8 o'clock. So I'm your host today. Anne couldn't be here, and so she asked me to stand in. So I hope that's okay with everybody. Um, so welcome to the intersection. We're in the middle of our 8 week mental health cycle. It's about 8 weeks. The intersection is, of course, part of now is now part of the Sacred Action Lab series. So this mental health series that we're in the midst of has been going on for several weeks. We've had some great presentations from people in the city and from other people in the big C city, that work for the municipal government and other people within the city itself that are working on mental health services. You can find all of those recordings on the Intersection blog and Intersection repository, which is on Sacred, and we will post a link to that. So just know that all these are recorded and available for you to use. So today we have a special guest from we have Hannah Yterdal, who's based out of the Dallas area, out of DFW, and she is the community medical liaison with Johnson and Johnson. And so her role is she's assigned to the state of Texas, and her role is to go out into the communities that in Texas and to talk about mental health and services and community building. She's part of a national group that Johnson & Johnson supports that covers most of the United States. And so we're really excited to have her. She's in San Antonio all the time. And so if you guys are interested in the meeting her, I'm sure she would be happy to set that up. Before we get to Hannah, I want to do a couple of announcements. The action lab for this series is going to be May 21st. So it's going to be a half-day symposium all around mental health. We'll have Hannah there again doing the full length of her presentation here, plus two other panels talking about um, co-occurring situations with mental health, whether it be dementia or brain injuries or substance use or other things, and then also talking about um, creating a welcoming space and training lay people in your offices about how to de-escalate and how to be more aware of mental health challenges of people coming into the facility. So those are very exciting. That's May 21st. That's going to be at Covenant Presbyterian. That's NAMI's meeting room over right at 410, kind of in between Northwest Military and West Avenue, kind of in that area. And then May 29th is the Bear County Behavioral Health Conference. That's going to be at the Norris Center. So that's another great opportunity. Um, and so we'll post links to all this in the chat. And before we turn it over to Hannah, let me just ask if there's anybody else who is interested in making an announcement or got something coming up that we all need to know. Anyone? Anne usually gets more announcements than I do, so I don't know. Am I doing it wrong? Okay, so we'll go ahead and jump in. So Hannah, it's all you.
Thank you so much. Good morning, everybody. I'm really excited to be here and excited to be part of the Action Lab on the 21st. Um, Bill sort of explained a little bit about who I am and what I do, but I'll give you the more in-depth explanation. So my title is Community Medical Liaison, and I'm part of a team contracted with Johnson & Johnson Neuroscience. We are all mental health professionals. So I am a licensed professional counselor in Texas. I've worked in the mental health care field for many, many years in a variety of capacities, from working in hospitals to community agencies, nonprofits, veteran services, all sorts of different things. And what I get to do now as a community medical liaison is mental health education. I always tell people they gave me this fancy corporate sounding title for mental health educator because, for all intents and purposes, that is what I do. Although I'm with Johnson & Johnson, I'm not part of any sales organization. Everything that I get to do is completely free and unbranded, meaning that I do not discuss or promote any product. That is not my goal. All of the education that I provide is really around helping folks living with mental illness to better understand maybe what's going on with them, becoming aware of their treatment options, and also for the folks who are supporting these individuals to better partner with and support folks living with a mental illness. Excuse me, Thursday morning and allergies. The voice starts to go towards the end of the week. Um, so I cover a lot around kind of diagnosis education, particularly around schizophrenia and other serious mental illnesses to help destigmatize these illnesses, make folks a little bit more aware of and combat misinformation around some very misunderstood and taboo mental illnesses. And also to provide just information, tools, and support to hopefully make people's lives a little bit easier and help people feel a little bit more empowered and engaged in their recovery process. So I partner with all sorts of different organizations, from actual treatment providing organizations like our community mental health centers, such as Center for Healthcare Services, advocacy, all sorts of different organizations, and really happy to have gotten connected with Sacred so that I can be involved in this mental health cycle of the Action Lab. So what I want to do this morning is just kind of preview a little bit of what I'm going to be presenting at the Action Lab, which is going to be around transitions of care in mental health. So this is a topic that is near and dear to my heart, having worked at kind of various places along the mental health continuum or the mental health care continuum, and having seen firsthand how the way our systems are very fragmented, and the sort of lack of support services has had some pretty detrimental consequences for a lot of people. So on May 21st, I'm going to get a little bit more in depth and be inviting attendees to have some more conversations around this with each other. But just to kind of give y'all a feel for what it is we'll be talking about, I'm going to share just a couple of the slides from the presentation, so you can kind of get a feel, maybe start thinking for yourself if you're going to be attending the Action Lab Day on the 21st. What sorts of questions you might have of other community members, what sorts of things you're offering in your role and in your position in the community. Now, here you go. There's your pause as we load everything. Can everybody see my screen? I can see a
You're
couple.
good.
Fabulous. All right. So, just to kind of tee this up, I always start with definitions, right? When we're talking about something, when we've identified a topic, we need to have everybody understanding what it is we're actually talking about. So, when I approach a conversation around transitions of care and mental health, what I'm talking about is that actual successful movement from one treatment setting or level of care, as we call it on the sort of clinical side of things, to community outpatient living at home, right? This less restrictive, maybe less supportive side of things. And the thing about our continuum of care is we kind of have a huge range, but not necessarily real close gaps, right? The gaps in our system tend to be very large. And they also tend to be pretty focused on specific types of services and interventions, maybe without recognizing that there is a lot more that goes into living successfully with a mental illness and maintaining health and wellness and recovery in the long term. So that's really what I hope to inspire everyone to be discussing on the 21st is where are those gaps in these systems? Where can we build bridges? Where can we identify those needs and use the resources that are in the community to help close some of those gaps and maybe offer some of those safety nets to people who are living with sometimes very challenging illnesses? So, as to set up definitions, a successful transition of care tends to have, I think, three sort of key factors, right? A continuous engagement of treatment and recovery support services, meaning that we don't lose contact, we don't kind of set something up and then send somebody off into the unknown without any kind of collaboration or support or communication. That collaboration and sharing of information among providers and services, which can be very challenging when so many entities in the system are completely separate operations. And we have a lot of laws and policies and procedures that protect privacy and make it hard to share information. But a successful transition would make sure we are offering that collaboration and finding opportunities for that sharing of information. And then the third thing is the input from patient and caregivers. I'll also say you'll see the patient language in these slides because I do often present to clinical providers, but insert whatever term feels most comfortable for you. Client, consumer, individual, right? Whatever feels comfortable to you. Patient is just one word that we might use depending on your position in this mental health care landscape. So what I am hoping we can be discussing on the 21st is how does the San Antonio community look at building systems and building relationships that can offer more opportunities for people living with a serious mental illness to have this successful transition, to make sure that we have that continuous engagement, that collaborative approach, and that person-centered viewpoint in these transitions. The other thing is that because of the way our systems are fragmented and the variety of organizations and services and stakeholders that we have in the community, is this recovery journey is pretty chaotic, right? So I really love this slide because it looks chaotic. It's essentially a visual representation of kind of the map of what our care system, our communities, et cetera, kind of looks like. And you can see if you are someone who's just kind of dropped into a random point on this map and you're trying to get to a completely different point on this map, there's often no clear avenue for how to get there. So for folks living with a mental illness, maybe their first stop on this map is at hospitalization, right? They are put into treatment, maybe against their will, given the circumstances, into these more restrictive, higher levels of care. And what they want and what their goal is to get more back to community-based services, somewhere in the middle of that map. But if we don't have good systems, if we don't have good directions, if we don't have good communication, it can be very difficult for people to find their way to these different systems. So the idea of building bridges, the idea of setting up avenues and roads that are more easily navigable is what I want folks to be discussing and thinking about when we're all together on the 21st and just in our day-to-day lives, right? We know that when we don't have effective supports and we don't have good transitional care systems and procedures, people do tend to end up back in the hospital very frequently. They end up on the streets more often than not. They end up in jails and in prisons, right? Unfortunately, our folks with serious mental illnesses are extremely overrepresented among our homeless and our incarcerated populations. So as we start kind of thinking about how do we shift this, what do we need to change? How can we come together as a community and a landscape to change this narrative a little bit? I want us to be identifying where are the gaps? Maybe there aren't actually gaps, but we're not aware of it, and we just happen to be sort of taking strange detours or hopping over things. And so I want folks to be thinking about what are the needs in the community that will help people stay on track with their health and wellness so that we're not seeing the consequences of these gaps in care. And how do we reach out and collaborate with each other in a way that's going to make it as easy as possible for everyone? No pulling teeth, no railing against the universe about how difficult things are. How do we build bridges that are going to be stable and sustainable in the long run? So we're going to talk about this from a very holistic kind of perspective and approach. I know there's going to be quite a few people from different sort of spots on this map, and that is ideal, right? We need treatment providers, we need community services, we need peers, we need folks who are not clinical professionals, um, addressing just basic needs, food, housing, all of that kind of stuff, right? But oftentimes we're working in our silos and we need to start breaking apart those silos. That's where we know we have success is when we're able to come together as one unit, as one team, as opposed to these fragmented puzzle pieces that we're trying to force to fit together. So, like I said, we'll get a lot more in depth into that on the 21st if you'll be attending. If you're not attending and you are interested in diving more into this, I work, like I said, with so many different organizations all around the state, and I'm always happy to collaborate with new people and new organizations. So please feel free to contact me, reach out to me. We always talk about this too, like, sometimes we tailor this to individual kind of situations or teams, depending on what's happening. I also do consumer and caregiver education as well. So partnering on educational events for folks actually living with mental illnesses and their loved ones, training for professionals, all sorts of different things. Again, all of which is completely free and unbranded to whoever may want it. All right. So, okay, I think my screen froze for a little bit there. But that's what I wanted to preview. And now I know we typically do kind of a Q&A kind of moment. So if we want to open it up, or Bill, if you've got a system
Yeah.
for that.
Yeah, let me jump in and just ask. So one, thank you for that. I love your graphics. Your imagery is really good. So let me just ask a little bit. So I know you're in the whole state of Texas. And I know that your focus is this mental health education. You've got this desire to kind of get in front of people. So how often are you in San Antonio, and kind of tell us about what you've already engaged in here?
Yeah.
And then the follow-up question will be, how this group can get in touch with you, and the kinds of things that you would like for us to call you about.
Yeah, absolutely. So I'm usually down in the San Antonio area. I try to get there at least every other month, sometimes a little bit more frequently. And I work with a few different organizations down there currently. So, Center for Healthcare Services being the sort of big, public mental health provider down there is one. Within Center for Healthcare Services, right, there's several different types of programs. So, working with case managers, peer support, all sorts of different things within that, where I do education for consumers to better understand, symptoms, treatment options, coping strategies, and support the work that the HCS does with their clients every day. I work occasionally with the San Antonio Clubhouse as well. If hopefully folks are familiar with the Clubhouse. It's one of my favorite models. Um, just Clubhouse International generally is a really fantastic concept. And so I will periodically work with them to do education for their members and work with them to make sure that they've got additional information and tools and resources and things. Um, Things like hospitals, support for providers, right? Like new residents in psychiatry, might be training around there for how do we better partner with folks who are receiving mental health care, right? One of the challenges that I have certainly witnessed is there's stigma and jadedness among professionals as well. And so a lot of what I do is trying to shift that, because we need mental health care to be accessible, not just logistically, but also emotionally, right? So I do a lot of education on that as well. So if y'all have any sort of educational needs that are around serious mental illness, right? So anti-stigma education, caregiver support, right? What do I need to know about my loved one living with a serious mental illness and how I can support them? If you are in the mental health care professional side of things and you want to know more about something like schizophrenia, your role in supporting folks living with serious mental illnesses, um, really anything around that. So, and my kind of goal is to help folks better understand and be able to better navigate treatment and recovery processes, whatever that may look like. I know there
All
was
right.
a second part of that
Yeah, thank you.
question,
Yeah, that
or
was
did I
great.
answer
Thank you.
all of it?
Let's see, any questions from the crowd? I
I'll
know
toss
there's a
one
lot of
out,
people.
Bill.
What was that?
Sorry, this is Billy. I'll toss one out. So, how do you see San Antonio compare to the other major metropolitan areas?
It's hard to compare different metro areas because, I mean, we were kind of chatting about this earlier. It's a little bit apples and oranges in some ways, right? Like similarities, but every metro area has its own unique challenges and things. I will say when I'm in San Antonio, I really do feel that community spirit in a way that I don't always feel in other parts of Texas. Not that there aren't folks in other areas that aren't trying or doing that work, right? But to have like the idea of sacred being one good example, right? A lot of like local conferences and meetings that bring a lot of different types of stakeholders together is something that I see in San Antonio area more often in others. Um, you also have some challenges that I think show up more often in San Antonio compared to other places, particularly around like demographics, right? Much higher it's still Texas, but a much higher population of Latino, Latina, and everything that that currently entails in terms of access to care and stigma and things like that. So, it's somewhat difficult in the sense that, like, generally speaking, every kind of area is going to have the same basic services on offer, right? Everyone has psychiatric hospitals, everybody has community mental health centers, everybody has some type of community non-clinical support like advocacy like NAMI or similar. But how those things fit together and how willing everybody is to collaborate can change a little bit. And just, I feel like when I go to San Antonio and I mention a program or I mention a service, everyone's already aware of that service in a way that doesn't always happen in other parts of the state. I wish we were like that up here in DFW, but sometimes it's like beating my head against a brick wall. No offense to my DFW folks.
Okay.
I just had a question for you, Hannah. Is there a particular community or location that seems to do a better job of efficiently managing limited resources when there's demand is much greater than the
Mm.
supply, and you know, how that looks if there's one that does it better than others?
I don't know about one that does it better than others. I'm generally impressed by the way a lot of more rural communities deal with their limited resources because there are unique challenges to our rural counties and our rural spaces. Like we don't have a bus that you can grab to get to your appointment, right? Everything's just more spread out. So, without public transportation, things might be more walkable in a place like San Antonio, walkable. Um, but I tend to, when I think of having a lack of resources, I tend to look towards our rural areas for inspiration because the way that they have to get creative with the limited resources in order to meet the needs of their consumers um, is is always really interesting, right? How do we physically get folks connected to services? How do we get providers and get services into areas where we don't aren't going to have the same sort of numbers as we have in a big city? Um, but a lot of what I see there too is who can really set up effective systems for that warm handoff, right? Where it's not just, okay, you're done with this service, goodbye, good luck. but where we have just a better sense of where somebody is going, and that it's easy to reach out and say, hey, we're sending somebody to you. Here's what you need to know. Here's something that might, help, that sort of collaborative, warm handoff kind of approach. So I can't say that anybody does it particularly well. I think I see it more in individual organizations or programs as opposed to larger communities, because everybody's got kind of different funding sources, and just all sorts of different logistical and local kind of barriers, and resources that it's hard to compare sometimes.
Right. I know there's a lot of people here on this call today. We lots of different organizations represented. So, NAMI, of course, is here, in the room, and there's a lot of people representing faith communities. Between NAMI and the H.E. Butt Foundation in San Antonio, there's a pretty significant level of outreach within faith communities to kind of build mental health awareness as kind of that relationship piece.
Mhm.
So I don't know if you've heard of that work that's going on here, but I think that's some really interesting stuff. Are you seeing that kind of faith community involvement in other cities as well?
A little bit. I think depending on where you are, there's varying levels of willingness to engage with the faith community, um, for a lot of different reasons. But some folks might view that as being sort of, oh, that's not, like, if I'm very clinical focused, I might think of faith community as being very outside of my clinical realm, or vice versa, and things like that. I actually have a colleague in another part of the country who has been doing some work with a system that is kind of a collaboration of clinical and um, um, faith community support services. That's been really interesting to see sort of develop, and also more involvement and more interest from faith-based treatment organizations as well, which kind of historically has maybe been an interesting place to navigate, because some faith-based treatment programs might be really leaning into the spiritual side of things and less into clinical. And so kind of seeing how things develop and how individual programs appear and connect to their community resources, is always really, really fascinating. But I wouldn't say that I have seen anything quite like how San Antonio has been doing it. I did see a thing pop up in the chat. I will put my contact information in the chat. I don't have any easy, like, visual card to share on a Zoom call, of course, which is just
Yeah, sure.
silly.
But
Um,
but
but
if people do want to invite you out to their organization or to talk to their group or to give a presentation or to come to have a conversation either with mental health providers or with people in their clients or people that are using the services of their organization, then
yep,
that you're available to do that. Yeah.
yep, 100%. That's literally my job. That's all I do, is go
Great.
around and do stuff like that. And just try to build relationships too, right? Because, I'm talking to folks at Clubhouse and someone mentions, wow, I really want to get involved with, where I'm looking for support with blank. And I can be like, oh, I was just talking to somebody from such and such organization. Like, that might be a really great place to reach out to.
Sure.
So being able to move through different and collaborate with different entities, is also a really fun and unique kind of thing for me to help facilitate, maybe start building some of those gaps, even if I'm not directly embedded in
Yeah.
your community as a resident.
Well, great. Well, thank you. So it's 8:30, so I know that we're normally scheduled until 8:30, so I want to anybody that has to leave and get on with their day, we want to thank you for being here, but we'll stick around for a few more minutes if people have questions.
I'm
Um,
putting contact,
uh,
right?
yeah, put your contact information in there. So, um, anybody else have something that they want to bring forward?
Yeah, I just wanted to bring up, Bill, that I work for the San Antonio Housing Trust, and we're working on a program in Cattleman Square with a consulting group called Eighth and Home to come up with a homeless response action plan and also a sort of community treatment plan for just the Cattleman Square geographic area. So I was wondering what your experiences have been with something of that magnitude.
Ooh, I'll say I'm guessing that's the neighborhood that you're referring to.
Yes.
So I'm broadly familiar as a visitor, frequent visitor, but not as someone who lives there. So with housing initiatives, I think that is an often overlooked and unfortunately deprioritized area in this kind of mental health care system. We think of it as being separate. But for example, with transitions of care being the sort of focus, we know that we could talk about different transitional care models and evidence-based practices and blah, blah, blah. The thing that helps people stay out of the hospital, out of jail is housing. When people have access to stable housing, they're more likely to stay in treatment, have good access to support services, et cetera. So when people have a place to stay, they're more likely to see better health outcomes. So I have unfortunately not had much opportunity to have sustained work with a lot of housing programs because so many of them have not been sustainable in different ways. So that's one of the challenges that I've definitely seen is how is it funded? Is it long-term funded? It tends to be one of the things that is downsized first when funding is lost, unfortunately. Even though again, we know it's very, very needed. And then the ACT model is something that I work with a lot because so many different community mental health organizations use the ACT model in some way, right? Where folks who have higher needs have that 24-hour access to more intensive care, that we've got a support team that isn't trying to respond to 50 different people with needs, but have their caseload, et cetera. And we know it's a successful model when we have that kind of easy access to wraparound services. So, I mean, the idea sounds incredible, and I really hope that it comes to fruition and is something that can stick around long term because we know housing and wraparound support services is the thing to help folks stay on track.
Yeah, it just seems kind of ironic that the Center for Community Health is like literally in that area, and and you see the resources there, but I don't see the connection working. But maybe they're overwhelmed also with too much demand and not enough supply.
I mean, I will say I know that they are overwhelmed and are dealing with funding issues, having like federal funding cuts and things like that. So trying to recently talking with someone there that some of their justice involved programs are being cut. So folks who have mental illness and are involved in the legal system in some way. Because unfortunately, that's just not been a priority for federal funding as of late. So they're trying to sort of redistribute folks who have been receiving those services and type of programs. I mean, the mental health care system is unfortunately always overwhelmed, overburdened, underfunded. So the best thing that we can do is keep talking about it and bringing awareness and advocating for those changes, right? That's how we see the changes. If we can show it works and save some money elsewhere, then let's do that. But that's an example of like, maybe we can start building some bridges, right? I'm involved with them. If I get connected with y'all, then maybe there's more opportunity there for some collaborative and open communication between these different services in the area.
Great. Thank you.
Yeah, absolutely.
All right, great conversation. Anybody else? All right. Well, if there's no more questions, then we'll end here. And so Hannah, thank you so much for coming, and I think it was great information, and we all look forward to seeing you on the 21st.
Absolutely. I look forward to it. Thank you, everybody.
All right. Thank you.
Thank you.